Hey everybody, and welcome back to another episode of Go Talk Smiles. I'm Dr. Valenzuela, pediatric dentist, clinic director at Farmville Pediatric Dentistry, and founder of Vital Oral Care, and your host for today. Today we'll be talking about something many parents think it's harmless, but can be a big warning sign, and that is snoring in kids. A lot of parents think snoring is cute or normal. The reality is healthy children should be breathing through their nose quietly while sleeping. So if your child snores regularly, it may be a sign of an airway or breathing issue. We're going to break down why kids snore, why it matters, warning signs parents should watch for, and treatment options that may help. So let's get into it. So first, what causes snoring? Snoring happens when airflow becomes partially blocked during sleep, and the tissues vibrate, causing or creating that snoring sound. In children, common causes include enlarged tonsils, adenoids, mouth breathing, poor tongue posture, narrow jaws, small airway, congestion, allergies, sleep disorder, breathing. And here's what surprises many parents. A child can look completely healthy and still have breathing issues at night. Parents tell me, oh, they always snore. They toss and turn all night. They grind their teeth. Or they sleep so deeply. Those are the things that we check for here at our practice. Now, let's talk about why this matters. Sleep is when children recover, grow, develop. If a child isn't breathing properly during sleep, their body may not be getting enough quality oxygen or restful sleep. Poor sleep in kids doesn't always look like being tired. Sometimes it looks like hyperactivity, behavior issues, difficulty focusing, bedwetting, mood swings, dark circles under the eyes, or daytime mouth breathing. Now, children who struggle with sleep may even appear more energetic or hyper during the day because their nervous system is overstimulated. Now, over time, chronic mouth breathing can even affect facial growth and jaw development. This is why airway-focused pediatric dentistry is becoming such an important topic. As pediatric dentists, we're often one of the first healthcare providers to notice airway concerns. We evaluate things like palate shape, breathing patterns, sleep symptoms, jaw development, crowding. Now, a narrow upper airway can also mean a narrow nasal airway. Kids who mouth breathe can also develop crowded teeth, long narrow faces, dry mouth, increased risk for cavities. This is why early intervention matters. If we identify these issues early, we may be able to guide healthier facial growth and development while kids are still growing. Now, let me just be clear. Not every child who snores has sleep apnea, but regular snoring should absolutely be evaluated, especially if your child snores more than 3 nights per week, sleeps in unusual positions, breathes through the mouth, grinds their teeth, has behavior concerns. Those are all potential red flags. Treatment depends on the cost. Sometimes children benefit from ENT evaluation, myofunctional therapy, habit correction, nasal breathing exercises, tongue-tie evaluation, allergy management, expansion treatment. Every child is different, which is why individualized evaluation is so important. The biggest takeaway from today's episode is this: snoring in kids is not something parents should ignore. Healthy children should breathe quietly through the nose during sleep. And when we improve breathing and sleep, we can improve overall health, development, and quality of life. If you found this episode helpful, please make sure to subscribe, follow, share with another parent, and follow along for more pediatric dental educational tips. I'm Dr. Valenzuela with Go Talk Smiles. See you next time.